There's a saying that goes, when someone tells you who they are, believe them. And so apparently there was some confusion when the board of Mission Hospital accepted an offer from HCA, where they must not have understood that HCA is a publicly traded company on a stock exchange. Well, why is that important? Well, this gentleman, Milton Friedman, was an economist who died in 2006, and he basically established the principle that a publicly traded company has an ethical responsibility to maximize profits for its shareholders. So, HCA, or once again the Healthcare Corporation of America, purchased Mission Hospital, which was a mainstay in the community of Asheville, North Carolina. Since that purchase, over 200 doctors have left the hospital. Many have left the community entirely. There are noted to be severe shortages of staff, and staffing ratios are very concerning. There are also concerns raised in the article about the fact that the hospital seems to be prioritizing profitability over safety. They cited a situation where sterile processing is not able to keep up with demands in the OR, and instead of canceling elective cases, which are profitable, they just pushed on in what seems to be unsafe conditions. This is not particularly an indictment by me on HCA Healthcare. We just need to know what we're getting. When practices are purchased by private equity, once again, they have a fiduciary or financial responsibility to maximize profits, and that will come at the cost of staffing, doctors' incomes, and a number of other areas where cuts are feasible and other areas where billing will be maximized. So, once again, I think we just need to accept that in American healthcare, if we allow for profit institutions such as publicly traded companies and private equity owned companies to own our institutions, we're going to see more of this. Well, sometimes people argue that nonprofit hospitals, which are the majority of hospitals in the United States, are actually basically for profit. This is not accurate in my opinion. It is true that the CEO and the officers of a hospital have a responsibility to their boards to make the hospital financially sound so that it can stay solvent, but they don't have the same responsibility to maximize profits at all costs in the way that a publicly traded company or a private equity firm would.